Now we're going to look a little bit more at maintaining homeostasis in the body, focusing on um, blood glucose levels or blood sugar disorders. Glucose is the main energy source for brain cells, and it's the only energy source for your red blood cells. Having too much or too little of glucose in the blood causes problems. And of course, if you get this too much or too little, that means you're out of homeostasis. And so what we get is diabetes, which is a disease in which the body does not produce or properly use insulin. And the cause of diabetes is a lot of different things: genetics, environmental factors, obesity, lack of exercise. Lots of people have diabetes in the United States. It's about 7.8% of the population. That may have gone up more recently. And even many people who don't realize that they have it and don't know. Now, there's a couple of ways of testing for this, and the most common is the fasting plasma glucose test. Or in the case of a lot of times pregnancies, they'll do the oral glucose tolerance test. The normal is for you to have a lower blood sugar level than 110. Or if you've got a higher than 126, then you are thought to be possibly diabetic, at least pre-diabetic, under the fasting plasma glucose test. Now, the oral glucose test would need to be higher than 140. Um, and if you can tell here, looking at this graph, that it's a very more highly diagnosed set of diabetes as you get older, of course. So this makes sense, especially for type 2 diabetes, where people develop it later on in life. It's more likely the older you get to develop diabetes. Now, there are different types of diabetes mellitus, and of course, it does cause all kinds of complications throughout the body. Type 1 diabetes, or also called, at least in the past, juvenile onset diabetes. This is where you have an autoimmune disease that actually destroys your insulin producing cells, which means you can't make the insulin you need, and you are having to require to take insulin injections. So therefore the body's failing to produce insulin, and then you have to get it from an outside source. About 5 to 10% of Americans with diabetes have type 1. More people who have diabetes are type 2 diabetics, and this is thought to be the adult onset diabetes, where you develop it later on in life. Target cells don't respond to the insulin that is produced, resulting in insulin resistance. So this is a condition where the body fails to properly use the insulin. It can also come from an insulin deficiency. That doesn't mean that you don't have enough, but that you don't make as much as you would necessarily need. So the majority of people in the United States that have diabetes have type 2. Now there's also a gestational diabetes where this is where pregnant women will develop diabetes during the pregnancy. So that's a possibility as well. And then there are people who are pre-diabetic, where you have a blood glucose level that's higher than normal, but not yet high enough to be type 2. This is where you are able to maybe make some changes in your life if you find that you are diabetic. Not to say that you shouldn't and couldn't change from being type 2 later, but it's more likely if you can catch it early to be able to make reversal easier. So in the body, there's a couple of functions. We talked more about endocrine, where the body produces things like insulin and glucagon. These are hormones. And then there are parts of the same body that parts of these organs and glands. There are also exocrine, which is these are enzymes produced for the digestive system. And occasionally you have organs that do both functions. Okay, in this case, um, the pancreas is one. Now, one thing the pancreas does for the endocrine system is to produce opposing or this antagonistic effect between insulin and glucagon. Insulin is produced to help cells uptake and store glucose. So when you have a high blood glucose level, you get insulin. Glucagon is produced when we need to make glycogen into glucose. And glycogen is that stored form. So when you have too low blood glucose, your glucagon will be produced to break down the glycogen into a glucose for the body to use. Alpha cells of your pancreas secrete glucagon. And glucagon will tell the liver to take glycogen and break it into glucose. Beta cells, on the other hand, will make insulin, and it targets your liver, fat, and skeletal muscle to actually take up and use. Okay, fat to maybe to store, skeletal muscle to make movement and use up that glucose, burn it up. Target your liver to just help with storage. So basically, insulin stimulates your muscle and your fat to uptake and use glucose. Okay, and also to convert it. The liver will help to convert it into glycogen. There's also a third set of cells that we'll mention here, the delta cells, and they'll secrete another hormone called somatostatin, which helps to inhibit both the secretion of glucagon and insulin. It's also got other functions, but that's all we're going to mention here. So, insulin and glucagon are a water-soluble mechanism, type of hormone. This is their peptide hormones. And this means that they cannot slide through the cell. They cannot just go through a lipid membrane, but they can be received on the outside of the cell, causing a signal transduction pathway where that secondary messenger on the inside, which will, once it's received, cause a secondary messenger like ATP to be produced into AMP, which will cause another series of reactions inside the cell, which will eventually cause a protein to be made in the nucleus, potentially. And so we see this back and forth. As glucose levels go up, insulin is produced in the pancreas. Insulin helps the glucose levels to go down. And we can go around and around. Now when it goes too low, glucagon is produced to help take glycogen and break it into glucose. And we go around and around until we get too high. And then we go back to producing insulin. And these things go back and forth with each other. So when you have the stimulus of having your blood glucose level being too high, your beta cells will produce insulin, causing the liver and muscle fat to uptake. And you'll see body cells, especially your muscle and adipose, which is fat tissue, take up and use the glucose. Cells in your skeletal muscle and your liver glucose will store glucose in the form of glycogen. The response is that you end up with a decrease in your blood glucose, which is good. It's bad to have too much in there. It can cause damage. Now, but if you go too low, your alpha cells will kick in, produce glucagon, and this will tell your liver to break down glycogen faster, that's stored form of glucose, and then turn it into glucose that the body can use. Then it will get passed throughout the body through the bloodstream. This will increase your blood glucose levels, which is something you need because your cells do run off of glucose. And if you go too low, then your body won't be able to do cellular respiration as it needs. So some of the complications that come with diabetes are, it can actually affect your eyes, your skin, digestive system, kidney, your heart, hands, and so on. Lots of different things. I'm not going to go through these in specific here, but some complications you might see. Basically what happens is that damage occurs. Okay, damage maybe to the eyes or to the feet, the extremities. Or maybe you'll see diseases appear because you've got too much sugar, in which you'll get fungal infections or gum disease from bacterial infections in the mouth. And of course, this is a big issue because you don't want those things growing indiscriminately. But if they have a lot of food on you and in you, then they might actually be happy to grow on you and in you. So you want to decrease your level of glucose, not too much, but enough to discourage this kind of infection. So you have a higher risk of diabetes for lots of reasons. If you're higher than 5 years old, or if you've had diabetes during a pregnancy, if you've had excessive body weight, especially around the waist, if you have a family history of diabetes, if you've given birth to a baby weighing more than 9 pounds. My father was, I think, 13 pounds when he was born. My grandmother did have type 2 diabetes, so he might have helped contribute to that. If you've got HDL cholesterol levels under 35, or high blood levels of triglycerides, if you've got high blood pressure or low activity level, and some people start to develop a skin condition called acanthosis nigricans, a thickening and darkening of the skin. And then there are certain ethnic groups that have higher propensity to get diabetes: African Americans, Hispanic Americans, Asian Americans, Native Americans. A lot of times these are groups that are lower income or poverty stricken, and I would say in some ways just having maybe not the most healthy because of their poverty types of foods. I would put Southern Americans down here too, because most of us have a higher risk of diabetes if you look at our family histories. So symptoms to look for are frequent urination, the body trying to get rid of that blood glucose. Excessive thirst, because you're trying to fill your body with water to get rid of that through urination. Extreme hunger, because your body's not uptaking the glucose that you have floating around. And so your body's like, well, I need more nutrients. Even though it's there, it can't respond to it, so or take it in. So your body doesn't get the energy to do cellular respiration that it thinks it needs to do. And it does need to do it, but you're not taking in that glucose like you need to. Unusual weight loss is a potential problem. Increased fatigue, again, you're not able to do cellular respiration because you need to get that glucose into the cell. Irritability, blurry vision. Anyone who's over 45 need to have blood glucose levels checked every 3 years. So regular testing of blood sugar levels should begin at a younger age if you know that you have a higher risk for it. And that's something I would suggest, especially as Southerners who probably have many family members who are already having this issue. So there are ways to prevent type 2 diabetes. You can prevent or delay the onset of type 2 diabetes through a healthy lifestyle. Just change your diet, increase your level of physical activity. We talked about that diet in the past. Maintain a healthy weight. And so sometimes you can even increase your health and stay healthier longer and reduce your risk of diabetes. In some cases, I've heard of people who've been able to reverse themselves out of type 2 diabetes, or at least for a time. I do want to mention the opposite. In some cases, people who go through hypoglycemia, um, you get blood glucose levels who are too low, and it will disrupt your normal body functions. This can happen for a number of reasons. If you're already injecting yourself with insulin, then you might over-inject, or you might overproduce in the case of some people who have an insulinoma, and in both cases will help to bring your blood glucose too low. And so because you don't have enough ATP made from that glucose, you get dizzy, confusion, shock. This is a little scary because these people need to get their blood glucose levels up very high. Not very high, but higher than they are when it's this low, because otherwise it can cause some major health risks. But you can see how having too low and too high of blood sugar are related to each other. Even if your problem is diabetes and having too high, there are chances where you can go into hypoglycemia because you're using insulin, medications, injections to help bring things down. And if you use too much but you don't have enough food in your body, or enough, which will produce enough glucose in the body, you have to keep that balance, that homeostasis. And it can be an issue for a lot of people.